Hello, I'm Marco Mula. I'm an epileptologist based in London in the UK. Welcome to this activity, Brain Health in 2024. What are the greatest unmet needs and how are we progressing? And it is my great pleasure to be joined today by a leader in the drive to improve the brain health in Europe, Paul Boon, a neurologist in Belgium and the Netherlands and current president of the European Academy of Neurology. So Paul, I'll ask you some questions about brain health, and our conversation will help our audience understand what this is and what they can do to improve the brain health of their patients. Because I'm an epileptologist, I'll guide the conversation towards epilepsy. Is that okay?
Perfectly okay. Hi, Marco. Good to see you.
So there is no doubt that neurological disorders are highly prevalent. 1 in 3 people have a neurological disorder, and they contribute to the global burden of diseases, more than 40%. So from that perspective, brain health becomes a big issue. But what is brain health?
Well, brain health, it has a general definition. There is no unified definition, but there is a working definition by the WHO stating that brain health is really a state in which every individual can realize their own abilities, optimize their cognitive, emotional, psychological, also behavioral functioning in order to be able to cope with life situations. So this would be a workable definition for brain health. If we zoom into that, and what it really means is that brain health has a meaning whether or not you have a neurological disorder. So if you don't have a neurological disorder, you typically have a better quality of life if you're able to empower your functioning. But even if you have a neurological disorder, improving the level of your brain health may eventually lead to better quality of life in the presence of a neurological disorder, and in general, being a happier person. So if we are talking about good brain health and promoting brain health, the idea is that this will ultimately lead to better quality of life for all, to a lower prevalence of neurological disorders among the community of people who are affected by neurological disorder. And if you want to put it in a more, let's say, epidemiological perspective, it will lead to fewer DALYs, fewer days or years lost because of disability, also, by the way, to a lower mortality. And eventually, which I believe is incredibly important to society, a reduction of healthcare costs and better use of taxation of citizens. Now, we want to become concrete. What do we know in terms of brain health determinants? What is the evidence base for particular recommendations that you find not only in scientific publications, but also in lay media? Well, it's very simple. In general, having good sleep, eating properly, avoiding brain trauma, make sure that hearing is adequate, make sure that cataracts are being treated in older people, so eyesight is maintained. These are among the, let's say, known determinants that could prevent people from becoming ill and could preserve and maintain brain health for a longer period of time during their life.
Okay, very good. This is very clear and very interesting. But who are the key players?
Well, obviously brain health is an issue for the entire population. Sick people go to a doctor. Healthy people typically do not go to a doctor. Sick people have patient associations, they have patient advocates. Healthy people do not have advocates, so we're basically talking about this is a public health issue. It's the entire community which is at stake. But obviously, if you now try to zoom down or zoom on concrete actions, there is some societies and bodies that are particularly relevant. WHO, the World Health Organization, is very much into prevention of disease for obvious reasons. The European Academy of Neurology, American Academy of Neurology, if we zoom into the neurological features, neurological part of health, brain health, and also the psychiatrist. There is an intimate link between neurological health and mental health. Now, that being said, I'm a neuropsychiatrist myself, but a representative of the neurological community. The European Academy of Neurology has established a brain health strategy under the motto, One Brain, One Life, One Approach. It was published 2 years ago. And what we have tried to do with the entire European neurological community is to come to a strategy aiming at reducing the burden of neurological diseases and promote the health of the brains, not only, as I said, of people who are sick, but also preventive actions toward the entire society. This is what EAN has done. Now, on a more global scale, WHO, which I just mentioned, is very much into brain health. And to make things very clear, WHO 2 years ago has declared officially that neurological disorders are a global health imperative. And that is the justification for a global set of global actions to be determined to promote brain health. I do not have the time to go into too much details, but it's all about formulating strategies that are valid globally and that can be applied to individual countries. One of the key performance indicators that should be the result of the IGAP actions is that in each European country, to talk about the area that we are talking about now, should have a brain plan. A brain plan that takes care of neurological disorders and strategies, also takes care of mental disorders.
But how should different specialties and different healthcare professionals work together to improve brain health?
Well, it is very clear from the beginning that this endeavor cannot be achieved well or can lead to proper solutions if it's done by neurologists alone. We really need to talk to other specialties, and I've already mentioned the psychiatrist as another highly relevant medical specialty. But it's clear that we not only need to talk and need the collaboration from medical professions, but also non-clinical professions. I mean, we need input from neuroscientists, we need input from other clinicians, other healthcare professionals, but also health managers. We need to have the support of the science community, because really new insights in improving brain health will also be driven by scientific discoveries. Now, it is, as I said, a matter of a large number of stakeholders, and it cannot be done by doctors alone. So what have we tried to do, what are we trying to do with EAN, is we have established the so-called Brain Health Mission. The aim of that Brain Health Mission is to bring together what I would call the usual suspects, like, EAN himself, psychiatrists, other medical specialists, patient organizations, patient advocates, but also companies. And not only pharma companies or device companies, but companies in their own right, companies that make part of the society. We want to have governmental agencies being involved, other bodies that have one thing in common. They should be interested in promoting and improving brain health. And you might wonder, why companies? Well, many companies, big companies, have come to the realization that their main resource is the brains of their employees. So for them, that alone is a justification to adhere to the Brain Health Mission. Brain Health Mission will work on different aspects, different pillars. It is about improving awareness. It is about providing education. It is about promoting science, and also creating a platform for advocacy on a European level. That means that EAN has approached policymakers. I've been talking to ministers of health, foreign ministers, to ambassadors, to state leaders. But that's one side of the spectrum. Another side of the spectrum is low-hanging fruit, as I would call it. Just to give you an example, a project that has been started in Austria now is being reproduced in Finland. We approach school kids, primary school kids. They take dental hygiene, knowing how to brush their teeth and realizing how important it is to brush their teeth. They take it very seriously. Well, our dream is that eventually these kids would also appreciate and would have some basic knowledge about determinants of brain health. So for them, brain health should be as evident as dental hygiene. This is really the dream.
So if I understood correctly, brain health means individuals functioning at the very best level they can, whatever medical conditions they may have. Correct. And our roles as clinicians may include research, raising awareness, prevention, acute treatment, or rehabilitation, but everyone is involved in brain health in terms of education, awareness, health policies, because everyone deserves a healthy brain. So there is no doubt that epilepsy is one of the most frequent, most prevalent neurological condition, and is also the one with the highest burden. So how do the principles of brain health apply to people with epilepsy?
Well, let's get back to the burden of epilepsy that you mentioned. We're talking about somewhere between 50 and 60 million people having active epilepsy, according to data from at least 5-6 years ago, so it's probably maybe higher. Mortality is high, prevalence is high, the contribution to days lost because of disability, mortality is high. Fortunately, the mortality is decreasing, but there is a higher severity of epilepsy in low-income countries. So we're talking really about a major contribution to the global burden of disease and to the neurological burden of disease. So what shall we do? And how do we link brain health with epilepsy? Well, first of all, best thing would be to prevent epilepsy. And I'll come back to that in a sec. Reducing the burden of seizures in patients who have existing epilepsy, who have active epilepsy, and also creating and supporting systems to wider health and quality of life in patients who live with epilepsy. What about preventing epilepsy? Well, there's a couple of key evidence-based factors. Reducing cardiovascular risks, which will reduce stroke-linked stroke vascular epilepsy. Improve neonatal care, that will lower the number of kids that later on need neuropediatric care and develop epilepsy because of neonatal issues. Reduction of traumatic brain injury. There's a very clear example that in all countries that have mandatory use of motorbike helmets, to give one example, has given rise or has resulted in a dramatic decrease of post-traumatic epilepsy. What about reducing the burden of seizures in people who have epilepsy? Well, the first thing that we commonly advise to people, you're very well aware of that, is advising healthy lifestyles. Take measures like keep an eye on your sleep, make sure that you sleep well, reduce excessive stress, physical and psychological stress. We could improve access to genetic diagnosis in order to identify actionable causes and guide treatment for these patients, prevent genetic causes of epilepsy. More commonly applicable is to optimize the treatment with anti-seizure medications. The key determinant of brain health, wellness in people with epilepsy is complete seizure control. Moreover, adequate treatment with anti-seizure drugs, if that is done properly, may reduce the effect of side effects, adverse events with epilepsy. We should realize that some of the burden of epilepsy is also caused by the treatment of epilepsy, and that requires adequate treatment. And last but not least, there is this wider field of improving physical and brain health in people with epilepsy by reducing environmental factors. I would call it stigma. I mean, we should fight social discrimination. We should support people with epilepsy to pursue active healthy relationship, help them in vocational training. So it is having seizures or having epilepsy is much more than having seizures. So we should be aware of these environmental factors as well.
Indeed, this is very true. And with the new ILE definition of epilepsy, epilepsy is now recognized not simply by the enduring predisposition of the brain in generating seizures, but also by the cognitive and psychological consequences of the condition itself. So can a brain health approach prevent or ameliorate all the different aspects of the epilepsy?
Well, yes. Answer is clearly yes. And let's now focus a little bit on these accompanying features of epilepsy. We're really talking about optimizing the seizure treatment, the anti-seizure treatment. We are talking about improving social contact. We're talking about reducing stigma, as we just said, and ameliorate and try to improve these aspects. What are we particularly talking about? The key accompanying aspects are cognitive decline, cognitive complaints, memory complaints basically, and on the other hand, mood disorders. This is intrinsically linked to the epilepsy, to the underlying condition, but to make things worse, potentially worse, the anti-seizure treatment, as we've discussed, can also make these aspects worse. Depression is highly prevalent, cognitive disorders are highly prevalent. And moreover, in patients who have accompanying neurological disorders other than epilepsy, for instance, migraine, stroke, and dementia, they have a high likelihood of also having seizures. So there is this close link between epilepsy on the one hand and other neurological conditions as well, and a close link between epilepsy and underlying conditions, I mentioned mood and cognitive disorders, and the potentially detrimental effect of the treatment of epilepsy on these two conditions.
Is there any learning about brain health that we can apply to our patients in our daily practice, things that our audience may be doing already or should continue doing, or things that they could start doing tomorrow?
First, in the specific context of seizure treatment, adherence to treatment, compliance. Take your pills regularly, follow the advice that you get. More genuinely, I would say, be active, move physically, watch your sleep better. So if we focus a little bit on these main factors, what about exercise? Exercise has two sides. Exercise is clearly healthy for your brain. It is a preventive factor for patients with dementia, but how should we see, active movement, sports in patients with epilepsy? Well, there's no clear evidence that exercise either improves epilepsy, reduces seizures. Is there a risk of making seizures worse? It's a bit of a question mark. The overall evidence is that physical exercise generally improves quality of life also in people with epilepsy. If they have a higher level of fitness, they will feel better, clearly, and it will also most likely improve their neurocognitive outcomes.
And now with the ILE report on sport, neurologists have also a sort of background framework to provide advice to their patients about safety of some sports, whether some of them may be safer than others. But what about sleep? Do you have any advice?
Well, sleep is not or lack of sleep rather, is not the cause of seizures, but it's a precipitating factor. So clearly avoid systematic sleep deprivation. It's just bad. It provokes seizures. It will ultimately lead to worse quality of life, which means good sleep hygiene, adequate sleep routine, sufficient and good quality sleep. Sleep hygiene is the key word. Some people need to be taught about that. And we organize sleep courses, where people get very practical advice about how to improve their sleep routines, anywhere from, the type of bedroom that they sleep in, the type of bed, and so on. Treatment of sleep disorders typically involves the intake of sleep pills. Not such a good idea to give additional benzodiazepines to people with epilepsy, certainly if they're not controlled very well, because there's lots of issues with and long-term side effects of benzodiazepines. In older people, less sleep is needed. Lack of awareness about this feature may lead to sleep misperception. So we need to teach older people that maybe if they sleep only 6 hours but they're not tired the next morning, it's perfectly fine. And then the other key thing is that some of the anti-seizure medication may interact with healthy sleep. Lamotrigine is known to increase awareness, increase alertness, not a good idea to give the full dose of lamotrigine in the evening, to give an example.
So to recap, in a neurological condition like epilepsy, the principles of brain health apply first to preventing its occurrence.
Yes.
Second, to reducing the burden, whether that is optimizing medications or managing seizure triggers. And third, in supporting the wider health of the person through things like managing all the associated factors, associated disabilities, and encouraging a good physical health and good sleep. What does the road ahead look like for brain health?
I think you gave a perfect account of what we have been discussing. What is the roadmap? Well, I can actually literally use a roadmap that we are currently publishing. The European Academy of Neurology has written a follow-up paper on the strategy paper that I was just referring to, basically defining a more concrete roadmap in a time frame of about 2 years to promote and improve brain health in Europe. That involves, among others, concerted actions towards the main stakeholders, providing a framework for national neurological societies and also call for change, a call for action towards policymakers in terms of promoting brain health. I think I have stressed the need for collaboration, but also public engagement. This is a public health issue, not only limited to doctors and to patients, but to the entire community. The need for better education, continuous education, is extremely important. The Brain Health Mission, I believe, is a very important initiative where EAN is approaching as many stakeholders as possible in order to ultimately influence policies that will lead to better brain health for all. Last but not least, I would really call for much more research, much more funding for research in order to find and to develop, to do research that leads to better determinants of brain health. Lots of preventive factors in terms of brain health and neurological disorders are not known for the present. So we need more research.
And what is the time frame for this roadmap?
Well, the most optimistic scenario is at least 2 years.
Okay. What are the three key takeaways that the audience should take into their clinical practice regarding brain health in epilepsy?
First of all, be serious about appreciation of the size of the problem. I repeat, neurological disorders, 1 in 3 globally, and global proportion of contribution to the burden, more than 40%. This is insufficiently known, and we need to make this more known. So this is a matter of awareness. Secondly, epilepsy, as one of the more prevalent neurological disorders, places a large burden on patients. It is associated, in addition to mood disorders and cognitive problems, and they can by themselves be worsened by the anti-seizure treatment. So any improvement in preventing epilepsy and improving brain health in people with epilepsy will clearly have a very large impact. And last but not least, what we should expect from the scientific community, the medical community, is more tailored, more personalized treatments to treat epilepsy and its associated symptoms.
So to summarize, in terms of brain health in epilepsy, we can say that the first point is improve accuracy of epilepsy diagnosis, including more information about genetic background, more individualized data to offer really personalized medical care. Appreciate that epilepsy is not simply having seizures, and inform patients and support them with all other associated problems, but mostly support and guide health policymakers, because you can have a healthy brain even if you have epilepsy. So thank you, Paul, for this conversation.
Thank you, Marco. It has been a true pleasure. Thank you so much.
And thank you for participating in this activity. Please continue on to answer the questions that follow and complete the evaluation.